As a plastic surgeon, a common question I'm getting these days is, what is an en bloc removal of my breast implant? When we're doing an en bloc removal, what we're trying to do is we're trying to remove the scar tissue that forms around that implant fully intact. So let's say it's an old silicone implant. What you don't want to do is you don't want that silicone to sort of rupture as you're removing the implant. So we're trying to remove the scar tissue and the implant all in one. Sometimes much more easier said than done. That breast tissue can be very thin, that implant can be stuck to the skin. So sometimes you just physically can't remove the entire scar tissue en bloc. But let's take a look at some examples. In this first image, what we're looking at is an en bloc removal of that implant. So this is the scar tissue that's fully intact, and therefore any of the contents of the implant haven't leaked out into the body. In the next image, what we're looking at is the implant being removed from inside that capsule. And we can see that the implant itself is fully intact. Physically, sometimes it's just impossible to do a complete en bloc removal of the breast implant with all that scar tissue intact for numerous reasons. And there are times when some of that scar tissue does get left behind, or some of that silicone does get left behind. And that's something you really need to discuss with your surgeon.